Hello, my name's David Stuart. I manage a drug and alcohol service for the lesbian, gay, bisexual and transgender community. It's based in London. It's the UK's only LGBT drug and alcohol service. The trends we're seeing there mostly are MSM, that's men who have sex with men, gay men, using drugs, mostly crystal meth, GHB, GBL and Mephedrone. They're using it almost exclusively in a sexual context, and that's quite challenging for a lot of drug services that are used to heroin or crack or alcohol, and perhaps not so much in a sexual context, but in a homelessness, crime, poverty sort of context. So that is quite challenging. These people would prefer to go to sexual health clinics or to gay services to talk about their sexual behaviour, where it's very much tied up with. The harms too are less about crime and poverty, although that's starting to develop, but it's more about the sexual health consequences. We're seeing a very steep rise in HIV transmission. 1 in 5 gay men in London are being diagnosed with HIV at the moment. That's kind of a new trend. And those trends are coinciding with this increase in injecting use of crystal meth and Mephedrone. So we're very alarmed about that and trying to watch and trying to work out what to do. What we're doing is reaching out to sexual health clinics. This population of people prefer not to go to their traditional drug services, favouring to go to a gay charity, but even that's a drug service, rather than going to a drug service where they feel you have to be ready to talk about your drugs. They are going to the sexual health clinics to address the sexual health consequences. Perhaps they need their gonorrhea medicine or something like this. And so we've reached out to those clinics and tried to form partnerships, educate the sexual health workers about substance use, using new techniques to help people engage, motivational interviewing techniques to help people address the ambivalence that they might experience if they're not ready to make changes, but just helping them be safer, practice safer sex, get better sex, and have a good time. In 2005, no gay men were coming to our service injecting drugs. Historically, gay men have used ecstasy and cocaine and they've partied. It hasn't really been very hardcore. There haven't been a lot of dreadful consequences. That's changed really dramatically in the last few years to injecting. In 2005, as I said, no one was coming with injecting drug use. 2010, it was 30%. It's quite a steep rise. But in 2012, that rose to 80%. That's a phenomenal change, and it's a really alarming one. And of course, it brings Hep C into the picture too. Hep C is a problem amongst gay men anyway, more amongst HIV positive gay men. And that's worrying too, because more than 70% of the gay men using these drugs in this context are HIV positive, and it's probably the reasons they're doing it, besides fun, is that it's a response to the changing HIV world. Simply wearing a condom it's more complicated than that now. Many people have undetectable viral loads, and they're being told it's harder to pass the virus on if you take your medicines. People aren't taking their medicines while they're high. Another trend is the psychosis that we're seeing. A lot of people turn up because these drugs keep you awake for such a long time. People experience psychosis. It's a short-lived psychosis, but longer than the average drug-induced psychosis. It usually lasts for about 6 to 10 days after a person stopped using the drug. It's indistinguishable from schizophrenia. It's people feeling very unsafe. We're sectioning quite a few people as well, which is a brand new thing for the gay community. Another problem is the injecting drug use again, in the sense that the gay community, historically not having been large injecting people, they're less exposed to safer safer injecting techniques and where to get clean needles, and so they're injecting with more ignorance, and so Hep C and HIV is being spread more easily.
What were the challenges would you say the challenges are for the mainstream services now?
It's quite a big challenge. Historically, drug services are very historically substance use has been about heroin, crack, cocaine and alcohol. They're the main harmful ones, the problematic drugs. It's quite a shift. It's been the same for decades, so suddenly for this enormous change to happen, one, just different drugs, which we don't understand, which there's not a lot of literature on. That's really challenging. But another problem is the sexual context. It's quite hard for anyone to sit down and listen to someone who's done really extreme, harmful, dangerous sex, things like getting fisted and stuff for 3 days. That seemed like a good idea at the time, but they're really experiencing the consequences afterwards, and they're wondering, why do I keep doing this, and why am I exhibiting this behaviour? And it's tied up in a very complex mixture of their relationship to sex, about gay sex being about disease, gay sex being the naughty kind of sex, the sinful kind of sex, and so it's a kind of acting out. And so the challenge for drug services is really to get trained up, get skilled up, broaden our minds. There's reasons why people are doing this. We mustn't judge people for being gay. We don't do that anyway, but we mustn't judge people for self-harming or even for going to extreme measures to find a solution to a problem, because that's what's happening.